Good day, everyone, and welcome. My name is Rudy Page, and I'm really pleased. We've got Kai. We haven't met for some while. Now, Kai has recently authored the book, The Sickle Cell Guide, which provides all the information needed about sickle cell disorder, the world's most common and fastest growing genetic condition. It helps organizations and individuals on their journey of understanding and better healthcare. Kai, good to see you again.
And you, Rudy?
Great. So before we get into the book, Kai, can you bring us up to date in terms of what you've been up to since the last time we met?
Since the last time we met, I've been keeping busy running my company. And in between that time, I've written a couple of books, and we'll cover one of those today, which relates to sickle cell, known as the Sickle Cell Guide, and I'll post the link.
Mm-hmm. So just for those who may not know, can you tell us what sickle cell disorder is?
Absolutely. So my background is having been chair of the Sickle Cell Society for a good number of years now, nearly a decade in actual fact. And that question comes up a lot. You know, what is sickle cell? So I'm going to give you, just for this first point, a full answer. Sickle cell is the result of an absolutely awesome and highly successful genetic mutation. And that genetic mutation affects 300 million people on our on our planet, according to the World Health Organization. So that's a very good authority. The mutation affords an element of protection from malaria. It's not immunity, but it works in a manner that's not dissimilar from the way the COVID vaccine operates. However, if a sickle cell gene is inherited from both parents, it results in sickle cell disorder, which is a lifelong condition. Now, sickle cell disorder is invisible, meaning that you can't tell who has it just by looking at them, even though it has a devastating impact on a person, and of course, on that person's family and their quality of life. So sickle cell disorder, as you said, is the world's most common genetic blood disorder. It affects how oxygen is carried in the body. Regular blood transfusions are often required to try and keep people well. A high proportion of people with sickle cell also suffer disabilities like stroke, damage to bones, joints, and vital organs, which can lead to organ failure. And the condition is seriously life-limiting. Sickle cell is the world's fastest growing inherited condition. In people with sickle cell disorder, the red blood cells change shape after oxygen has been released, and it makes them look like crescent moons. In this form, the red blood cells get stickier, and they stick together as well as to capillaries, causing blockages in small blood vessels in any part of the body where you can find blood. The result is excruciating pain, likened to repeatedly and relentlessly being hammered. Many mothers with it have commented that the pain is worse than they had with childbirth. Sickle cell disorder is also known as a fluctuating condition, meaning that in some and in many people, there are periods when they appear completely well, functioning as if unaffected by any kind of illness. The crucial thing to note is that if you've met one person with sickle cell, then you've only met one person with sickle cell, because the impact of the condition differs. And that impact is affected by one's medico-socioeconomic status. Remember, health is so much more than a medical matter. And this is a powerful message that resonates throughout my book.
So what was the initial driver for you to write this guide in the way that you've written it?
It's a book that I've needed throughout my life, and no one had written such a book. So whilst I was chairman of the Sickle Cell Society, which is that national patient organisation in the UK, everywhere I went, Rudy, both nationally and when I was giving international speeches at conferences, it was clear that there was little to no knowledge that existed. And despite everyone asking for more information, it simply wasn't available. Now, I would talk, but you can't be expected to sit there and write down everything that I've said. So I decided I'd write something comprehensive that people can keep on their coffee table or in their office reception, and essentially be guided if I'm not around. So we know that in the health service, things are not getting easier for people with sickle cell. So I feel that this book is very well timed, even though I needed it a good 40 years ago in order to get me through life.
Yeah, no, absolutely. You know that old saying, the best time to plant a tree was 20 years ago. The second best time is now.
I agree.
Excellent. And actually relating to that is in terms of research, and particularly into the quality of care for sickle cell patients. I mean, what's been the movement around that, and how much does your book cover that area? Because obviously influencing policy and service delivery and improvement through the system, or even in the community itself, by the community.
The book is meticulous in its research in these areas. One such global survey is called SHAPE, S-H-A-P-E. It's otherwise known as the Sickle Cell Health Awareness Perspectives and Experiences. And that research found that doctors didn't understand people with sickle cell. There's cultural differences. They simply said, you know, these people with sickle cell, we just don't understand them. I mean, that's not a good reason to not provide good health. You know, everybody needs to be able to rely on medicine. There's also the SWAY survey. And the SWAY survey highlighted that 40% of patients actively avoid going to hospital to avoid the trauma of poor care from medical professionals. So that's the international perspective. So we're not talking, the book is based on looking at the world in general, and it also has a national perspective. So what's said nationally? Well, there's the patient reported experience measures that people that are friends with it call PREM. It was the biggest national survey ever, and it highlights what the national problems are. And it says that care is substandard. And this has been reported way back to the Black Report. It's very, very clear. Doctors simply don't have enough information. The care that's provided is poor, and people suffer as a consequence. Now, I just mentioned the Black Report, and the Black Report was 1980, and it said that care being provided to people from diverse backgrounds is very poor. So we need to do something about it. And then the Aitchison report came out in the 90s, the late 90s. Yeah. And the Aitchison report said, well, the problem is not any better. And then we had the Marmot report in 2010. Yeah. And the Marmot report said things are getting worse, but let's review it in 10 years. We're going to improve things. And in 2020, the Marmot report found that things are getting worse. And even Professor Fenton's report, which was related to COVID in Black communities, identified that there was a surging disparity in the way in which care was delivered to diverse peoples, Black people.
Kai, can I just ask you on that note then? So why is it then research proposals are turned down at the high level that they are? as it relates to the academic world then?
The
What is it? What is the issue?
yeah,
Why research proposals don't get through, don't get into policy, don't get into practice, don't get into the system? So
now I've been chair of a group that looks at things like that and trials. And what we found was that there was a lack of representation from people from Black communities. What we also found from studies in America is that there was insufficient policy supporting the need for further research. So in America, there's actually laws that ensure that the thoughts in terms of development and the provision of funding must provide for people from diverse backgrounds. And what that did is it increased the amount of research that goes towards things like sickle cell. So if I give you a quick example, cystic fibrosis, okay, there's 10,500 people suffer from that in the UK, and sickle cell, 15,000 people, unlikely to be considerably more. Now, the study found the following. Cystic fibrosis receives 40 times more funds, both from the state as well as from other sources. And so that answers your question in terms of why there is a lack of research and why we're calling for more research in sickle cell. Now, you might ask the question, what was the outcome of the vast amounts of work that are done for, say, some other conditions? And remember, I'm never about pulling other conditions down. But for example, cystic fibrosis has 511 treatments that are approved. Sickle cell has 6, and there's only been one new treatment that was approved in the last 3 decades, which is crizanlizumab. But hopefully that answers your question very clearly and distinctly. There's a huge disparity.
systemic.
And we need to change that.
So as a corollary to that, what might improve quality and patient safety for people living with sickle cell disease?
Well, the crux is, and we had a parliamentary inquiry on this point, reported in a document called No One's Listening. And the crux is that there isn't a level playing field for all ethnicities. And what we need to do is remove the structural, systemic, and institutional barriers that affect providers of services. And also, we find these issues within organizations because they don't recruit, and their promotion and their retention and their representation needs vast improvement. If you want to see an example of what I'm talking about, just look at the reports that have come out on the police, but more hospitals. So you've seen the QE2 hospital in Birmingham, just 2 recent examples amongst decades of examples that I could go into, but I won't today, that identify that these need to change. They're really hard, intractable matters, but they really do need to change if we're going to improve the quality of patient care and patient safety. And so you'll find the book, The Sickle Cell Guide, has a whole chapter on solutions based around my experiences and ensuring that there's far better representation. You know, if you don't include the people that are impacted by a condition and you don't include their voices, you don't give them an opportunity to be involved, what do you think will be the outcome of that kind of a situation? So there's areas that we need to be able to improve, and we need allies to work with us, working together within the NHS and within various service providers, and also the whole ecosystem that relates to pharma, etc., and will bring about those changes.
And on that note, do you see much advancement within sicklers themselves and the families and the communities where they come from, the African Caribbean population groups. I mean, how has that improved over time?
Over time, there hasn't been a lot of improvement. What you tend to find, Rudy, is it's cyclical. So for a short period of time, there's some change. Very much as we all noticed post what happened to George Floyd,
right?
Rest in peace. And there were a lot of people said, we're going to make changes, but do people really stand up? Did those organizations really stand up? So we need to bring about that change through a complex series of mechanisms. And so the improvements, we're always discussing things like quality indicators. Well, if you can't measure it, you can't manage it. And if you can't manage it, you can't change. And what tends to happen, Rudy, is that we go through an NHS hemoglobinopathy review and we set a number of indicators. But unless you are reporting on those performance measures, it's very hard to see how things will change. So I'm a big advocate of if you want to understand how organizations think, what their strategies are, you've got to engage with their leaders, and their leaders need to engage with goals, and those goals have got to be reported upon to see the direction of travel and see how things are changing. And we've just not had that business-like approach in the past.
Yeah, and of course, some level of accountability somewhere and some evidence that somebody's listened and can feed back to those who, you know, who are impacted day to day in their day-to-day lives.
I was recently impacted, and because of the poor care, I ended up in intensive care for a period of time. And it's so imperative that the leadership of hospitals get some kind of clear direction for making these improvements, working with the patients themselves. Otherwise, things will not change.
Yeah, indeed. So when we met before, you did speak about parents, you know, researching for a cure for their children, their child. So how much of that element of what we spoke about before influenced the writing of the book?
Absolutely. My readers care about their health, just like your viewers. And, you know, people care about their health, and people need to have help at their fingertips from time to time. So what I've tried to provide is an absolute one-stop shop. So the Sickle Cell Guide, in providing that, if you want to know what cures exist and you want to know how to get involved, what the eligibility criteria is, how it might affect you during the process, what help you can get, what trials you can go on, what advice goes along with those trials, what kind of support is needed because, you know, if you're taking time off of work, these are very expensive, but you can get an array of support increasingly. What the risks are and what the outcomes are, and examples of people that perhaps have gone before. Now, these are all really important in terms of aspects of being able to help people to avoid them having to do months and months of research, which is what people used to have to do. But hopefully the guide will help them through.
Right. So you're actually describing very much the lack of education and knowledge on sickle cell disorder amongst the public, but also the challenges around access to the information, advice, guidance, and support. So your book will certainly make a contribution to that. So where can people get it? But more importantly, are there any kind of networks that some of the parents can be part of, and where would they get this information? Because we both know getting together with peers, people with similar challenges, sharing that learning is an essential part of improving the quality of life for for your loved ones?
That's a great question. That's kind of like a three-parter. Let's take the first part. Where can you get the book? Well, you can buy the book on Amazon. So you go to Amazon, tap in the Sickle Cell Guide, and I've also put the link in the chat. And then in terms of what they've said about the book, it's had a fantastic review by The Lancet. You know, I couldn't have dreamed of a better review. And other people have reviewed the book, and the common thing that is said is that the language is clear and accessible. It's got illustrations and templates. The guide is hailed as providing complex information on scientific clinical issues in a way that is easily understood by the lay public, those living with sickle cell, their carers, health and allied professionals, students, as well as qualified professionals in the fields of health and social care. So in the book, where I have been quite meticulous about links, you've got the support groups up and down the country, which you will be able to find on the Sickle Cell Society's website. But through the book, you get a direct link to the list of support groups that exist around the country. And then in terms of places where people can have forums of conversation, there's not many of those. They're kind of sporadic. But what I'm looking to do, and just trying to work out a strategy for, is a place where we can have a podcast. And I know you do some of these things, Rudy, as well. But it is essential that there are places and spaces where you can have relatable conversations about the day-to-day cut and thrust of life. Because people from sickle cell, when the stats have been looked at, 66% of people with sickle cell live in our most deprived communities in the UK. So there's a lot that we can do to help each other. And there's a lot of conversations that are needed, because talking really does give people roots to change.
And of course, as a long-term condition, diabetes, mental health, hypertension, all these other conditions, I think it's important for people with sickle cell disorders to be part of those groups as well. They will find that they will have a lot more in common: diet, nutrition, activity, all those kind of areas that's still important, and particularly mental health, of course, but also, as you mentioned previously, which people living normal lives, that people can cope and go through life. And we might be quite surprised, some of the people who have sickle cell, and they're leading normal, productive lives just like everybody else and beyond.
Absolutely. Our public will often say, what is this sickle cell thing?
Mm-hmm.
And the discussion that comes out is very much as we started, what is sickle cell? And that's quite a very focused, but we are human beings and people that have all sorts of family things, jobs, and the day-to-day cut and thrust of enjoying life. And it's very important that people are seen to be those people. It's just that we live in a manner that makes us a huge amount more resilient as human beings. And that means that we've got a lot to say and a lot to give as well.
And I think it will be great to hear the journey, the day in the life journey, and really describing the things that are done in order to get along just like everybody else. That's great. So the book is also dedicated to your 7-year-old son. Could you give us a bit more about why and what's the background to that?
Yeah. So Zane was a fantastic supporter of people living with sickle cell disorder. And he used to take time out on his weekends to fundraise for the cause. And this is Zane right beside me here, beautiful 7-year-old Zane. But what happened to Zayn is he was killed when a nerve agent infused our home during the floods of 2014. And proper investigation has simply been avoided to this day in what elected officials call a cover-up. So Zayn's in the Labour Party manifesto as a justice campaign, a social justice campaign. And anyone willing to support Zayn can do this by signing Zayn's petition. 118,000 people already have. And we will get the truth for Zayn, and we'll get that legacy that plays forward the love that little Zayn gave to us through his own caring. And the Lancet Review saw that it was just and right to take the dedication in the book, and they provided links to Zayn through their review. And so I'll put that link into the chat. So anyone that wants to go to the Lancet, it's the April version of the Lancet. It's page 249. And so you'll be able to see that for yourselves.
Great. Thanks for that, Kai. So we've come to the end of our dialogue, and just before we go, please just remind everybody where they can get that book, Sickle Cell Guide.
You can get the Sickle Cell Guide at Amazon and all good bookshops. Just write the Sickle Cell Guide, and it will come to you. And I would be humbled that anyone takes the time to look at my words, but in many ways, for me, having such a guide would be a game changer, and I hope it's so for you.
Yeah, and if anybody wanted to connect to you directly, is there any contact that you can give?
Yeah, you can contact me at www.sicklecellchair, all one word, .com.
Excellent. www.sicklecellchair.com.
And you'll see some videos there too.
Excellent. So thank you very much, Kai, and look forward to our next dialogue.
No, always a pleasure, Rudy.
Great. Take care.
Thanks for the chat.
Bye.
Bye-bye.